Good afternoon, and thanks for the opportunity to talk to you today about St James's Hospital and our Living Lab initiatives. My name is Gemma Garvin and I'm the CIO for St James's Hospital. Some background. I took up the position of CIO in St James's almost 2 years ago with the objective of practically implementing digital solutions to help drive healthcare forward in St James's and to have our hospital act as an exemplar for digital health delivery in Ireland. I've worked in healthcare for 20 years and I'm passionate about the ability for digital health to drive healthcare delivery to the next level in this country, to bring us in line with other countries and to help us achieve the government's objective of providing the best possible care that the state can afford for Irish citizens. St James's is the largest academic teaching hospital in Ireland. It's a 940 bed facility with 25 inpatient episodes a year, over 290 outpatient episodes, and has one of the busiest emergency departments in the country with over 49 encounters annually. It has over 4,500 staff and a turnover of 400 million annually. St James's has a fantastic reputation for the delivery of high quality healthcare and attracts the most prestigious clinical minds to work here. It's well positioned and has the ambition to act as a digital exemplar for healthcare delivery in Ireland, to demonstrate how healthcare can be delivered more efficiently and effectively through digitisation. So as a hospital CIO, my focus is the focus of my organisation. Like all hospitals and large organisations worldwide, St James's has set its ambition and its mission and strategic objectives so that all working in the hospital have the same understanding of why we come to work and what it is we're trying to achieve. The mission for St James's Hospital is to provide safer, better healthcare for our patients. This mission is aligned with government policy and expectations of all Irish citizens. This strategic objective of providing safer, better care is precisely what Irish citizens expect of the largest academic teaching hospital in the country. We have fantastic medical skills, world-class doctors, nurses and allied health professionals striving to achieve exactly this, safer, better care for our patients. In St James's, the executive team work hard to continue to attract and retain these exceptional people. We need to give them the tools to help them perform to their best. And as the CIO for this hospital, it's my focus to enable the organisation to deliver on safer, better care for patients. Part of being able to deliver on these objectives has led to us signing an MOU recently with the HSE to act as a digital exemplar, and to us implementing the concept of a living lab within St James's Hospital. You can see from the digital overview the size and scale of the digital footprint that exists across St James's campus, with over 188 applications in use to support the hospital's activity. So what is the Digital Exemplar Hospital Initiative and why have we signed the MOU with the HSE? So from our digital footprint, it's evident that St James's is well positioned to act as a digital exemplar. We signed the MOU to work with the HSE to explore the potential benefits of researching and co-designing and co-innovating digital health solutions to help provide safer, better care for our patients. With this initiative, we will look at the full scope of digital solutions, including our clinical systems such as our electronic patient record system, our virtual care services, and along with our patient engagement practices. Through our Living Lab, we can prove that digital transformations are implementable. And if it can be implemented in St James's, one of the most complex acute hospitals in the country, it could be implemented in any other hospital in Ireland. Our Living Lab initiatives are all undertaken with clear ambition and metrics so that we can demonstrate value. Part of our ethos within this hospital is to act as an academic healthcare institution, and that makes it a natural fit for us to share our learnings with other sites and with the HSE. So as part of our Living Lab initiative, we're focusing on implementing and expanding our virtual care across the hospital, but also on the enhancements of our on-campus care delivery through digital technology, quality data and combining this with our academic partnership with Trinity College and our status as a teaching hospital and a centre for clinical research. Our virtual care governance committee was established, and we agreed that the ambition would be that we would look to implement virtual care rather than have a standalone telehealth solution. And we differentiated this by documenting that we would look to embed and record the patient's consultations using the same system of record, regardless of whether patient was seen in person, via a telephone consultation or a video consultation. This led to us modifying our EPR to build the capability to capture outpatient consultations on our EPR and have a standard form of recording the consultation, which asked the clinician to simply record if the consultation was in person, over the phone or via video consultation. But then they were to follow the same consultation notes and store it with the patient's full patient record in our EPR. These EPR modifications meant that the patient care record was up to date and accurate, and an accurate record of all consultations was being recorded. So there's a full spectrum of virtual care being planned and implemented across each of the care pathways in the hospital. Looking to our pathways with our clinical community and also with the patients themselves. As part of these care pathways, we've agreed to enhance and review the systems that will be needed to implement these changes in care pathways and ensure that all the consultations are recorded accurately to provide safe care for our patients. So one of the Living Lab initiatives that I was asked to speak to you about today is our work on video consultations. We worked with the Digital Academy Forum back in March when COVID first emerged to prove that BlueEye video consultation product from RedZinc could be implemented in an acute hospital setting. We were the first site to go live on March 15th with the BlueEye product, and our scope, or our allied health professionals, and our oncology team were the first to implement it. Our clinical team's feedback has allowed us to work with RedZinc, the supplier of BlueEye video, to provide improvements and enhancements for improving end user experience of the tools. We worked extensively with our clinical teams to agree on the operating procedures for running the video consultations, which we have shared with the Digital Academy and with the HSE. Another initiative was in response to the rapid requirements for our occupational health and psychological well-being team to provide services to staff during the pandemic. So we rapidly developed a staff engagement platform called myStaffSpace, and it was for occupational health, contact tracing, and staff health and well-being. This has been designed to share so much of the content and the functionality with agreement could in theory be used by other healthcare facilities. My colleague Sonia Collier in St James's did a good overview of the myStaffSpace initiative, which I'll play for you now.
I'm delighted to showcase the St James's Hospital Staff Safety and Wellbeing app. In doing so, I am representing dozens of St James's Hospital staff members from across many departments and directorates, who, like so many during this COVID-19 crisis, have generously gone above and beyond to contribute their expertise to the app content. The St James's Hospital Staff Safety and Wellbeing app, also known as the myStaffSpace app, has its origins in a general awareness within the St James's Hospital community that the COVID-19 crisis had the potential to create significant challenges for all St James's Hospital staff, both physically and emotionally. In the early days of last March, that seems so long ago now, there was a sense of the calm before the storm. Yet while there was an eerie quietness around the hospital, as our doors closed to visitors and many patients stayed at home, there was a tidal wave of guidance and information emerging on a daily basis. Guidance on PPE, on treatments, on self-care. surreal and sometimes worrying reports coming from China, Italy and Spain on the impact of the virus on patients, but also on the well-being of healthcare staff and society as a whole. Newspapers, social media, TV reports and inboxes were dominated by an overwhelming amount of often contradictory information. As knowledge grew about the virus, so too did the number of so-called expert voices and reading materials. So much so that for many of us there was a sense of information overload, and it was difficult for all to weed out the wheat from the chaff, the important, useful information from rumour, opinion or speculation. It was out of this that the Safety and Wellbeing app was born, a virtual hub where all staff would have access to current, accurate, reliable and relevant information. The vast majority of it written and developed by St James's staff for St James's staff. Led by Una Geary and her QSID team and steered by Una Kennedy, Brian Goff and the Person-Centred Care Committee, staff from many different departments in the hospital found ways to share their expertise with colleagues, creating resources in easily digestible formats. This included videos, sound files, illustrations and infographics, as well as the more traditional written format. I'm delighted
That gives you a good overview of the myStaffSpace platform, which really was a collaborative multidisciplinary project within the hospital that proved very advantageous for our staff members. So following on from the success of the myStaffSpace initiative, and as our teams became familiar with the engagement platform, it became an obvious choice for us to address the advanced communications needed with patients as a result of COVID. So our Living Lab has developed, in conjunction with the wider DATS-led group, a pilot of a patient engagement platform to help improve communications with our patients and to help the hospital to operate more effectively during these pandemic times and into the future. Again, I'll play a video for you now which gives you an overview of the myStaffSpace project that is being currently worked on and that we hope to go live with later this month.
St James's Hospital are working with myStaffSpace on a project to streamline outpatients. COVID-19 has brought a host of new challenges to outpatients. One example is the calling of patients for COVID screening before their appointments. This is a very large undertaking. We are providing tools and interfaces to enable the callers to manage this process more efficiently, while also supporting more self-service screening models. Patients will be able to download the myStaffSpace app and self-screen before their appointment, as well as getting the up-to-date information for what to expect when they arrive. Patients under specialty care will be able to get disease-specific information and to help them self-manage and to be able to set reminders and track their progress. Patients can get timely reminders throughout their care journey, automating a lot of manual calling, as well as tracking their progress for their care teams and themselves. Care teams can be directly connected with their patient cohorts, sending them messages, updates, surveys, calls, and also allowing patients to actually self-service and request services from them, such as ordering prescriptions. Using the web and mobile interfaces, care teams can engage with patients and remote manage them in the home. This is a sample of some of the work we're looking to do to streamline and reimagine outpatient.
So we hope to give you more of an update on the myPatientSpace at the next forum meeting. Remote monitoring tools are emerging and becoming more commonly used. So this is the last area that I'll speak to you about today in terms of our Living Lab initiatives. We have reimagined services using IoT devices for remote monitoring of patients in their own homes. So in St. James's, our Living Lab is using IoT tools supplied by Patient Empower to support home oximetry monitoring and a COPD outreach programme. We are also trialling an IoT device for home sleep studies, which allows the patient's sleep patterns to be monitored using a device called WatchPath that they can wear in their own bed, preventing the need for the patient to be admitted into the hospital to have this study undertaken. These initiatives are very much aligned to Sláinte care, where the patient receives the care they need in the most appropriate setting, closer to or in their own home. So in terms of where we want to get to in St. James's Hospital is to have the ability to have a fully digital campus and to have the concept of a command centre available to us, where we know everything that's happening across the campus in real time and can make informed decisions to ensure that the hospital is operating as efficiently and effectively as possible, and with the ability to adapt to changes as needed. Our Living Lab initiatives will enable us the evidence needed to get there. So to summarise, our Living Lab initiative will help us deliver on the ambition and will help support data-driven healthcare, which is a mechanism to provide evidence to support Sláinte care's objectives of enabling care in the most appropriate setting, provide evidence to enable activity-based funding and the appropriate distribution of exchequer funds for health, enable the sharing of information with the patient and other healthcare professionals, meeting citizens' expectations, and finally to expedite health research and improve patient outcomes. We all want the excellent work that's been done in health research to be supported so it can deliver findings quicker and evidence to support changes so that we can truly provide safer, better care delivery, not just for St. James's patients, but for all Irish citizens, for our own children, our parents, our partners and our own health.